Well, we hope you enjoyed that wonderful interlude. It's still TVC Breakfast Saturday, and Emmanuel is back.
Absolutely, absolutely. You know, looking at the front pages, interesting stories there.
I know.
And it's a good one for Nigerians that the president is indeed working to ensure that with this tax reform bills, we hope things will also get better for the vulnerable in the country.
Absolutely.
Nigeria.
And so, still, of course, talking about, you know, the vulnerable in the country, you know, these are, you know, what everybody's hoping that, you know, we indeed move past the arguments, the law, you know, all the delays that this tax reform bills incurred towards the latter part of the year. Now that the governors have agreed,
we saw the
that
new recommendations
it's
from
in
the governors' forum.
It's in the best interest.
We hope that the discussion will continue in the National Assembly.
Absolutely, absolutely. Now that the action has moved to the lawmakers. All right, let's now come back to continue with you know, yet another crucial conversation, and that is the issue of providing equitable access to healthcare for every Nigerian, as this is central in the country's National Health Act. Well, Nigeria has one of the fastest growing populations globally, with 5.5 live births per woman and a population growth rate of 3.2% annually. It's also estimated to reach 400 million people by the year 2050, becoming the world's third most populous country. Now, that is according to health reports. And so the significance of primary healthcare centers in fostering health equity and enhancing health outcomes cannot be overstated, especially in low and middle income countries. Experts also say there is the need for the federal government to make health infrastructure one of its priorities, with accessibility and affordability of basic health care, the need for quality equipment, bed spaces, and enough medical professionals. All these are crucial to the health sector. Joining us now for this conversation from our Abuja studio is Professor of Obstetrics and Gynecology. He's also the Chief Medical Director of the Nnamdi Azikiwe Teaching Hospital in Anambra State. We thank you very much, Professor Ogbaja, for joining us on the program. You're welcome.
Thank you, Kemi. Viewers, you're welcome to the program.
Right, and talking about ensuring the vast part of Nigerians, in fact, all Nigerians, that they enjoy basic health care as enshrined in the Constitution and all the extant laws. Let's first begin with your take on the Ministry of Health, the Coordinating Ministry of Health, Professor Ali Pate, who said this week that talking about the budget now, because that's the language, that's one of the biggest stories in the country right now, how departments, ministries, agencies are defending the budget. Before we even talk about this year's budget, last year's budget, according to Professor Pate, he says only about 15% of the monies earmarked for the health ministry, you know, that's only what they got, 15%. And how then do we talk about this law when we have, you know, the issue of healthcare, basic healthcare being accessible for Nigerians? What's your take, Prof?
Okay, thank you, Kemi. Thank you for the question. I also heard when the Honorable Connecting Minister made that statement. And I don't think it's a negative statement, because if you look at the funding in this year to health, you must agree that there's a significant increase in federal funding of the health institutions and the health ministry activities. And the Honorable Minister has actually said that. He was relating to implementation, and all of us are aware at the national level that implementation actually didn't start early for 2024 appropriation year. And so, and then of course, we know that the appropriation year has been extended. In recognition of this particular fact, the National Assembly has to extend the appropriation year further to allow agencies, to ramp up their procurement and appropriation. And a lot of kudos must go to the coordinating minister for being able to ramp up funding for the health sector. You see, for a long while, We've been crying about underfunding, inappropriate funding for the health sector and all of that. But since the Honorable Connecting Minister came on board, relying on his expertise, relying on his reach, relying on what he knows how to best, we are beginning to see a significant increase in the funding of health services in the country. And that is a very good thing for the country. Of course, today we are going to talk about infrastructure, ramping up infrastructure to aid quality health services and all of that. At the bottom line, at the center of all of this, you must agree with me, is funding. And he has done very, very well in terms of the funding. If you take, for instance, at my institution,
okay,
we've been able to move to the... Okay.
Well, talking about funding is something that is still debatable, because when you look at how much has been budgeted to the health sector in Nigeria, it's still far what we see in other developed countries. Talk to us. What are those things now Nigerians should be seeing in our hospitals in the country to avoid this medical trip outside the country when some of them are seeking for better health care services?
No, it's true. It's true. We know the standard, what it ought to be. But then again, you must appreciate progress when you see progress. We've been here for a long while. I've been in health management for some while, and I know what the funding is. So when you see reasonable effort and significant improvement in funding, you know, Rome was not built in a day. So it is a journey. And he has done very well in terms of ramping up funding. So we cannot get to the standard, all of it. And remember when we discuss about the basic funding of health, it's an aggregate funding. The federal government plays its part, while the state government also plays its part. And so you do not assess the funding of health sector only by the federal allocation. You must have to input the state funding and to some extent donor funding. And so for him and for us at the federal level, we are seeing a significant increase. We are not there, we are not there yet. There's no doubt about it. We are not there yet. But you must appreciate the progress. That's why if you visit our hospitals as of today, the federal tertiary hospitals, you will see significant transformation in terms of infrastructure because of his approach. Because he has come with four-pronged approach, and all of us are keyed in clearly. And so any hospital you visit in Nigeria today, you must see a reasonable transformation in infrastructure, in in capacity building and all of that. That is all kudos to his effort. And of course, if we are thanking him, we must also appreciate Mr. President for bringing him on board. We can't have it better with any other person at this point in time. The minister is doing what is ought to be done. You see, it's become very challenging managing public institutions, but his coming on board has actually made a whole lot of things easier for us because we have access to him, and he's knowledgeable in terms of managing the health sector. So all of us are keen, and that's why all over the country today you see significant transformation. Of course, he's working with a team. It's not him alone. The ministry is there, the presidency is supporting him, and then my colleagues, the chief executive officers of the tertiary institutions, are doing exceedingly well. In fact, I'm going to host them in April, in the first quarter of our quarterly meeting. And we are going to discuss. The minister is also going to be there. And so we have this our quarterly meeting where all the chief executive officers of the federal tertiary institutions, congregate so that we look at issues, we look at ourselves, we speak ourselves. And he's always there to educate us, to guide us. And then if we have issues, we discuss with him. He's a guy that you can access freely. And so we are doing well. In terms of the funding, yes, we are not there, no doubt about it. But you can see the effort. You can see the progress.
All right, Prof.
And most importantly, you can see the transformation at the system, at the level of the hospitals.
All right, Prof.
Okay?
Allow me to ask further, of course, while we're on this subject, and it's good you say that you're also preparing to host your counterparts across the Federation, as
yes.
well as the coordinating Minister for Health. Let's talk about how things are looking in Anambra State now that the Nnamdi Azikiwe University Teaching Hospital has moved to its permanent site. I think it's getting to a year now since what many have called a breakthrough. But let's hear directly from the horse's mouth the impact of this move, especially as we talk about better infrastructure in terms of health.
Thank you, Kemi. Thank you very much. In our meeting in April, we're also going to celebrate the second year anniversary of our movement to the permanent site. You see, our hospital was established in 1988. And prior to my coming on board as the CMD, they were at the temporary site. And that's what I'm saying. With the help of the leadership of the ministry, especially with the assistance of the coordinating minister on health and social welfare, Professor Lepate, CON, we were able to move to that permanent site. And he was there last year to assist us. Now, what was the vision in moving to the permanent site? All we are doing is to give life, to give vent to the vision of Mr. President, which is access to quality care for all Nigerians. And so the permanent site enables us to build the basic infrastructure, to get the requisite equipment, and of course, to get the manpower towards giving help, not just to people in Anambra State, not just to people in the Southeast, but to all Nigerians. And so when I came on board in 2021, we developed a new vision because everything starts with leadership. And that's why we are enjoying this cruising aspect in our leadership, in our profile because of the minister. Everything starts with the leadership. So when I came on board, what we did was to define a new vision for the hospital. And we said we want to rank among the 3 best hospitals by the year 2030. And that was our 10-year plan. And so we developed our strategic plan and developed our 9 pillars clearly to align with the pillars of the minister. The vehicle the ministry is using is the Nigerian Health Sector Renewal and Investment Initiative, which has clearly 4 pillars. And so we aligned our 9 pillars alongside the ministry's pillar. Our first pillar is leadership, effective governance. The second one is building infrastructure. The third one is human capacity development, and all of that to the 9th pillar. So what we saw that happened at INEW is that day in, day out, we work along our pillars. For instance, in the effective governance, which we align to the ministries, is just to build a group of people who will help us, who will assist us to execute our vision. Because a vision that is not communicated is a dead vision. And it's all about teamwork. And so what we did is to recruit a crop of professionals who we know not only believe in our vision, but have the capacity to execute that vision, aligning with the ministry's initiatives. And that's what we did. And then again, we now got down to building the infrastructure. Of course, for you to build the requisite infrastructure, we also have to learn from the master. Here, our primary master is the coordinating minister. I mean, he has seen it all. And so he's using the sector-wide approach. And that sector-wide approach emphasizes multi-sectoral, multi-governmental collaboration to build infrastructure. And that's what we did. And so if you come to our institution, you see the projects that we did from our funding. You see the ones that we did for health agencies we are collaborating with. You see the ones that are done by individuals in Anambra. Because we are blessed in Anambra State, we have individuals who are willing to assist us. And all we needed to do is to show them the reason why they should come in. And once they believed in us, they came in. We have all of them, Saimeko for Chief Cletus, Beto, Atwez, all of them came and built infrastructures. For agencies we are collaborating with, the Office of the Special Advisor to President on SDG helped us a whole lot. The LNG helped us, the NNPC are helping us, and all of that. So Prof, it's a sector-wide collaboration.
Prof,
and we learned it from the coordinating
Just
minister.
a moment, Prof. You have a lot of interesting development, talking about your visions, your pillars for the indigenes of Anambra and also to Nigerians. But talk to us. What are those key initiatives put in place for that vulnerable in the society to be able to tap into this service delivery that you're bringing on board?
Okay. Again, because that is also along one of the pillars we are playing with. Taking it from the ministry again, because currently, I'm sure you must also know, from the Federal Ministry of Health, being championed by the coordinating minister, that there's a provision for ambulance and emergency services, where if you have accident victims without payment, the hospitals will pick them up and treat them. And then, of course, his most recent initiative, which I consider as a life-changing initiative for Nigerians. He has made that policy, has made that pronouncement that delivery, including cesarean section for the vulnerable and of course for the poor, are going to be free. And not like he had just mentioned a policy statement, he has now built structures around it clearly through the National Health Agency. And then of course he is building regional mother and child centers, of which my hospital is benefiting. So he is setting up 6 regional mother and child hospitals that will be equipped, properly equipped, standardized, that will coordinate these activities region by region. And he has mentioned it, that delivery, including cesarean section, is free for Nigerian women, for the underprivileged and the vulnerable. I mean, what else will he do in mother and child sector, I mean, to show that? So it's not that he's just making policy statement. No.
Right.
He is putting structures in place. Now, under the National Health Insurance Scheme...
Apologies, Prof. We've run out of time. If you can hear me. Prof, I was trying to get your attention earlier to try to bring this home so we can end the interview because time isn't our friend. Please, we ask that you bear with us because we've run out of time on this conversation. But we thank you very much for the much you have been able to put across on this very pertinent subject. Professor Joseph Ugbaja, who is the Chief Medical Director of the Nnamdi Azikiwe University Teaching Hospital, we thank you again for your time.